Good morning. Today's presentation is about child abuse. The definition: any intentional harm or mistreatment to a child under the age of 18 is considered child abuse. Physical abuse occurs when the child is purposely physically injured or put at risk of harm by another person. Sexual abuse: child sexual abuse and any sexual activity with a child. This involves sexual contact, such as intentional sexual touching, orogenital contact, or intercourse. This can involve non-contact sexual abuse of a child, such as exposing a child to sexual activity or pornography, observing or filming child in sexual manner, sexual harassment of a child, prostitution of a child, including sex trafficking. Emotional abuse: it's about emotional child abuse, meaning injuring the child's self-esteem or emotional well-being. It includes verbal and emotional assault, such as continuing to be berating the child, as well as isolating, ignoring, or rejecting the child. The medical abuse occurs when someone gives false information about illness in a child that requires medical attention, putting the child at risk of injury and unnecessary medical care. Neglect: child neglect is failure to provide adequate food, clothing, shelter, clean living environment, affection, supervision, education, or dental and medical care. In many cases, child abuse is done by someone the child knows and trusts, often a parent or other relative. If you suspect child abuse, report the abuse to the proper authority. Child neglect is failure to provide adequate food, clothing, shelter, clean living condition, affection, supervision, education, or dental medical care. In many cases, child abuse is done by someone the child knows and trusts, often parent or other relatives. If you suspect child abuse, report it to the authority. The symptoms: child who's been abused may feel guilty or ashamed, confused. The child will be afraid to tell anyone about the abuse, especially if the abuser is the parent or relative, family, friend. That's why it's vital to watch for the red flags, such as withdrawal from friends or usual activities, changes in behavior, depression, anxiety, fears, sleep problem and nightmares, apparent lack of supervision, frequent absence from school, rebellious or defiant behavior, self-harm or attempts suicide. The warning sign is unexplained injuries, such as bruises, broken bone, or burn, injuries that do not match with the explanation given. Injuries that are not compatible with the child's development ability, sexual abuse signs and symptoms, sexual behavior or knowledge that is inappropriate for the child's age, pregnancy or sexually transmitted infection, genital and anal pain, bleeding, injury, statement that the child, he or she, was sexually abused, inappropriate sexual behavior with other children. Emotional abuse sign and symptom: delayed or inappropriate emotional development, loss of self-confidence, self-esteem, social withdrawal, loss of interest or enthusiasm, depression, avoidance of certain situations such as refusing to go to school or ride the bus, appears to be desperately seeking affection, decrease in school performance or loss of interest in school, loss of previously acquired developmental skills. Neglect signs and symptoms: poor growth, excessive weight, medical complications that are not being addressed adequately, poor social cleanliness, lack of clothing or supplies, meet the physical needs, boarding school, hoarding or stealing food, poor record of school attendance, lack of appropriate attention for medical, dental, psychological problem, lack of necessary follow-up care. Parental behavior: sometimes the parent's demeanor or behavior sends the red flag about the abuse of a child. Warning signs include parents who show little concern about their child, appears unable to recognize physical emotional distress, blames the child for the problem they have, consistent belittling or berating the child, describes the child with negative terms like worthless, evil, expects the child to provide attention and care to the parent, and seems jealous of family members getting attention of the child, use harsh physical discipline, demands an inappropriate level of physical and academic performance, severely limits the child contact with others, offers conflicting or uncovering the explanation for a child injury and no explanation at all, repeatedly bring the child for medical evaluation or request medical tests such as x-rays, lab tests for concern not seen during the healthcare provider examination. Physical punishment. Child health experts condemn the use of violence in any form, but some people still use physical punishment, such as spanking, discipline their children. While parents and caregivers often use physical punishment with the intention of helping their children or making their behavior better, research shows that spanking is linked with worse, not better behavior. It's also linked to mental health problems such as difficult relationship with parent, low self-esteem, lower academic performance. Any physical punishment may leave emotional scar. Parent that causes pain, physical injury, emotional trauma, even when done in the name of discipline, could cause child abuse. When to see the doctor. If you are concerned about your child or another child that has been abused, seek help immediately depending on the situation. Contact the child's healthcare provider, local child welfare emergency, the police department, or 24 hours hotline for advice. In the United States, you can get information and assistance by calling or texting the Child Help National Child Abuse Hotline, 1-800-422-4453. If the child needs immediate medical attention, we need to call 911. In the United States, keep in mind, healthcare professionals and many other people, such as teachers, social workers, are legally required to report suspected cases of child abuse to the appropriate local welfare agency. This brings us to the end of the presentation. This is a very wide problem, undisclosed in the majority of cases. The kids that discloses these go through a difficult time. It's our duty as primary care to focus on these things and focus on the welfare of the child and make the call if it is needed or if you suspect any problem. Thank you.